You might have heard this nursery rhyme as a child.
Ringa, ringa roses, pocket full of posies. Usha, pusha, we all fall down.
But did you know it is believed to have originated from the Black Death, one of the deadliest plague pandemics in history. The ring of roses represents the rashes. Well, that's exactly what happened to millions. But plague wasn't just a European nightmare. India has faced its own deadly outbreaks, with millions of lives lost, entire cities abandoned, and fear gripping the nation. Today, we will uncover India's battle with plague, how it spread, how it was controlled, and whether we are still at risk today. What is plague? Plague is a rodent-borne zoonotic disease caused by the bacterium Yersinia pestis, primarily transmitted by fleas that lives on rodents like rats. There are three main types: bubonic plague, affecting lymph nodes; pneumonic plague, affecting the lungs, which is highly contagious; septicemic plague, spreading in the bloodstream, often fatal. Without treatment, plague can spread rapidly and cause widespread death. Bombay plague is one of the deadliest outbreaks in India, which emerged in the year 1896. The disease spread from infected rats, which arrived from the European ships, quickly engulfing the city. Panic set in. People fled in masses, unknowingly carrying the disease with them. The British government enforced three aggressive measures. Number 1, mass disinfecting of homes. Number 2, forced evacuations. Number 3, burnings of plague infected areas. The controversial British Plague Commission, which forcefully checked and segregated the suspected patients. Despite these measures, nearly 10 million people died in India over the next 2 decades. India's most shocking modern plague outbreak happened in 1994 in Surat, Gujarat. Initially mistaken for pneumonia, it was later confirmed as a pneumonic plague. Panic was immediate. Over 3 lakhs people fled Surat overnight. Hospitals were overcrowded. Neighboring states sealed their borders. India faced global scrutiny and trade bans. Thankfully, quick medical interventions, antibiotics, and better sanitation helped to control the outbreak in just a few weeks, with less than 60 deaths reported. How India controls plague today? After the 1994 Surat outbreak, India ramped up its disease surveillance and response mechanisms. India implemented 4 key strategies: early detection. The Integrated Disease Surveillance Program (IDSP) constantly monitors potential outbreaks. Number 2, rapid response teams. Trained medical professionals are ready to contain infections immediately. Number 3, improved sanitation, better waste management and pest control to reduce plague risk. Number 4, public awareness campaigns, educating citizens on hygiene and rodent control. These measures have prevented any major outbreaks since 1994. Can plague return to India? While plague is no longer a major threat, the risk still exists. Factors like climate change affecting rodent populations, unregulated urbanization creating unsanitary conditions, antibiotic resistance in bacteria could contribute to future outbreaks. However, with modern science and rapid responses, India is better prepared than ever. India's experience with plague teaches us: Number 1, quick action saves lives. Delays in detection can be deadly. Number 2, sanitation is key. Poor hygiene creates the perfect breeding ground for disease. Number 3, public cooperation matters. Misinformation and panic can worsen outbreaks. We salute all healthcare workers who work diligently to control the plague outbreak in India. Plague may have haunted India's past. But with vigilance, science, and public awareness, it can remain a disease of history, not the future. Act now by sharing this information.